A few months ago, 100 children were transferred from the fire-damaged Charlotte Maxeke hospital to the neighbouring Nelson Mandela Children's Hospital. Most of these little ones are from families who can't afford medical aid or private treatment, and they had nowhere else to go. Children's Hospital Interim CEO Nonkululeko Boykutso joins us for an update. Thank you very much, Nonkululeko, for speaking to us this morning. So how are those 100 little patients doing? Are they all still with you? And how are you holding up under the additional pressure?
Good morning, Annalie. So I must just say that fortunately Charlotte has been able to reopen some of their pediatric services, and so some of those little babies have gone back to Charlotte. We still have a few that are left behind with us now, and because of COVID and everything that's happening, we've also had to restrict the number of services that we have in the hospital. So we still have a few. It was a difficult 2 months, but we're more than happy to have them because there are very limited resources elsewhere, and we had the capacity to accept them in our hospital.
It's been such a difficult time for the country with COVID-19 pushing the limits of the healthcare system and now the recent unrest affecting many communities. What impact have you seen on children needing specialist medical care?
No, unfortunately, with level 4 restrictions, just like with many other hospitals, we haven't been able to provide our ordinary services, so we are just focusing on emergencies and looking at COVID patients and making sure that we have a capacity to accept COVID patients. So children are still waiting for a while. Hopefully, a lot of them are stable at home, and as soon as things reopen, then we'll be able to continue our services. And just patients being able to access when there's unrest in their communities, being able to get out and access services is also becoming very, very difficult. And we really hope that we'll find a resolution to that point. But most importantly as well, our staff members get really impacted when it's COVID. We're lucky enough to receive the Johnson & Johnson vaccine earlier on in the year, so expect them to make full recoveries, even the ones who get infected. It does become a very difficult environment. It's very stressful, a lot of anxiety when you have to treat a COVID patient and you know that you've got kids at home that you have to go back to. So it really hasn't been easy. And so we're really hoping that we've reached the peak in Gauteng especially, and things can get better and the unrest can be resolved so that we can have some semblance of normality.
So as you said there, because of COVID-19, you're offering limited services to children out there. Paint a picture for us of what that means, because although I know you said that, hopefully most of the children are stable at home, certainly a large portion of children are very vulnerable, and being unable to access medical care, either conditions will go undiagnosed or they will worsen, or emergencies might not be treated, with parents knowing that access to health care is difficult. Tell us what children at home may be experiencing during this time.
When you're sitting at home, you're correct. When you're sitting at home and there are restrictions to move around, certain things that you may take for granted as a parent because you're not sure how serious it is. So you may just sit and wait it out. So some kids may be diagnosed late. And the kids I'm talking about are some of the kids that we know that have gone through our hospitals and we're comfortable that maybe they're stable. But there are kids who are walking around or they're at home and they have conditions which remain undiagnosed. So even in the previous earlier on in the lockdown stages, like in 2020, we saw that a lot of children presented late with worse complications because parents just don't feel comfortable going to hospital because they themselves are worried about COVID. So there are always those concerns, and we encourage individuals that if there's something wrong with the child, if you're seeing a new symptom that you don't understand, please still do go to a hospital, because the last thing you want is to present and you're presenting late and the condition could have been treated so that it doesn't deteriorate or doesn't lead to fatalities or deaths in the children.
So tomorrow is Nelson Mandela Day, and in the spirit of the man whose name your hospital proudly bears, how can businesses, individuals and communities support and assist the hospital in its vital work?
Yeah. So this year, just like last year, we can't have our usual events where we really want people to come to the hospital to see what we do. And so we're really hoping that even using these virtual platforms and different channels, people can still donate to us financially. You can look at our social media sites, on our website. There are easy ways that you can donate, like on Snapchat. And you can give us a call and see what you can help us with, because we accept donations, in-kind donations, because not everybody has the financial resources to do that, but people can provide basic necessities for children, for even the young adolescent children that we have there, and some of our moms, because we have a lot of moms that come from very many places across the country, and so some of them need basic necessities. So corporates can still please assist with those using our various channels of donation.
Oh, thank you very much for your time this morning. Nelson Mandela Children's Hospital Interim CEO, Nonkululeko Boykhutso.